Sometimes when we think about drug addiction, you don't think about sometimes the caretakers, like your doctors and nurses struggling with addiction. We always, in a way, make an assumption that it's the patient with the problem and never thinking about many of these people are also out here working under the influence of drugs. It's probably more common than uncommon. In the past, I even had a few videos. I had one of a nurse that was clearly high, and she was in a patient room, and the patient took out their phone and started filming this nurse nodding, and you could just tell she was high. We know these things happen. They have access to medicine right there on the job. And, when you think about it, it's no telling how many in the profession that are also battling with their own personal addiction with drugs. Okay, this came out in NPR September 6, 2019 for health workers struggling with addiction. Why are treatment options limited? Well, they really shouldn't be, but you know, and this is not the only one. I also did a video probably about 2 years ago on an emergency room doctor up in Canada, and he had an opioid problem. And he was an emergency room doctor. Can you just imagine that? You are in many cases a life and death situation, and the doctor in the emergency room is strung out on opioids. Woo, he ended up losing his license, and he was fighting to get it back. He had gone through rehab and everything, and he was fighting to get his license back. But even if he got it back, would you trust a doctor that once had an addiction? I mean, that's something you really have to ask yourself. Would you really trust them to treat you? I guess some people would say yes, but I know plenty that would definitely say no. All right, I'm going to go ahead and play this audio.
When doctors and nurses become addicted to opioids and they get caught, they have to follow strict treatment guidelines to get their licenses back. Often that means they are not allowed to use the so called gold standard of treatment, medications such as methadone and Suboxone. NPR's Selena Simmons Duffin has more.
Here's how this played out for Dr. Peter Grinspoon. He got addicted to Vicodin in med school and still had an opioid addiction 5 years into practice as a primary care physician. Then, back in February 2005, he got in trouble.
In my addicted mind frame, I was writing prescriptions for a nanny who had since returned back to another country. And it didn't take the pharmacist long to figure out that I was not a 19-year-old nanny from New Zealand.
One day during lunch, he says the state police and the DEA showed up at his medical office.
I start going, "Oh, I'm glad you're here. How can I help you?" And they're like, "Doc, cut the crap. We know you're writing bad scripts."
He was fingerprinted the next day, charged with 3 felony counts of fraudulently obtaining a controlled substance, and he got referred to his state's Physician Health Program, or PHP. They work with state licensing boards. If you follow the treatment and monitoring plan they set up for you, they'll recommend to the board that you get your medical license back.
The PHPs basically say, do whatever we say, or we won't give you a letter that will help you get back to work. So they put a gun to your head.
And Grinspoon says they gave him very little choice. To avoid a criminal record, he needed to spend 90 days at an inpatient center in Virginia.
Why would you send this Jewish atheist to a Christian rehab place in Virginia? It didn't make any sense. I was just sitting there listening to people recite the Lord's Prayer and hold hands. They took me cold turkey off all my medications. It was completely insane.
He says medication-assisted treatment with Suboxone or methadone was off the table for him. Those medications are similar to opioids and work by suppressing cravings to the abused drug. Physician health programs, he says, effectively ban the use of these medications in the treatment plans they set up for physicians like him.
Why on earth would you deny physicians who are under so much stress and who have a higher access? They have free refills and they have a higher addiction rate. Why would you deny them the one life-saving treatment for this deadly disease that's killing more people in this country every year than died in the entire Vietnam War?
Grinspoon recovered despite what he called several awful rehabs. Today, he's a licensed primary care doctor and teaches at Harvard Medical School. He also wrote a book about his experience with addiction called Free Refills. Now, this was over a decade ago, but Dr. Sarah Wakeman, also at Harvard, says most physician health programs still don't promote medication in treatment for addiction.
The sort of general standard of care is to send people to abstinence-based residential treatment programs that don't offer medication treatment.
She just co-authored a piece in the New England Journal of Medicine, which called this, quote, bad medicine, bad policy, and discriminatory.
I think the underlying issue is stigma and the sort of misunderstanding of the role of medication, and this idea that a non-medication based approach is somehow better than someone taking a medication to control their illness.
So what do the institutions getting blamed here, physician health programs, have to say about all this? Dr. Christopher Bundy runs Washington State's PHP and the Federation of all the state PHPs. He says it's true that these medications aren't often used, but that's not because of stigma or ideology.
Proceeding with caution is understandable and warranted.
He says medication may be the gold standard of treatment in the general population, but there should be an asterisk when it comes to so-called safety-sensitive workers, not just healthcare providers, also pilots, for instance. He says the concern is that these medications can affect cognition. So the idea of people caring for patients while taking something like buprenorphine makes some people nervous.
We only need one bad outcome involving a physician with substance use disorder who's back to work. Then immediately the PHP is under the microscope.
He says then the criticism would be, how could you let that doctor work on a medication that could have played a role in that bad outcome? He doesn't know of a case where that's happened. Wakeman and her co-authors also argue there isn't clear evidence that these medications do impair cognition. Still, that fear could be what's driving the reluctance here. Bill Kinkle is currently navigating all of this. He lives outside Philadelphia.
I'm a nurse, and I'm also a person in sustained recovery from opioid use disorder.
He'll be eligible to practice nursing again next fall after 3 years of documented sobriety, and he's public about being in recovery. He even has a podcast. When he was addicted, he said he was under a strong impression he wouldn't be able to go back to nursing if he was in a medication-assisted treatment program. So he went to abstinence-based rehabs over and over again. And over again, as soon as the rehab ended, he relapsed.
A lot of those I overdosed, and had my wife not found me on the floor and been able to take care of me, I very well may have died. And all of that possibly could have been mitigated had I gotten either buprenorphine or methadone.
He doesn't fault the PHPs or the licensing boards for these policies, even though he thinks they put his life at risk. He thinks stigma against those with addiction is so ingrained in our culture, there's no one institution to blame. What's important is that this changes, he says, and health professionals have access to all possible tools in recovery. Selena Simmons-Duffin, NPR News.
You know what, y'all? I believe doctors and nurses should be held to a higher standard because they are the ones that are the caretakers and administering the meds, And you notice he got 0 jail time for what he was doing. They're literally forging a prescription and using the identity of someone that didn't even live in the country anymore. And he got no jail time. He got rehab. So, it's a new day and they see addiction totally different for very obvious reasons. And, things that people were punished for during the crack epidemic, they get off scot-free. Worst thing is rehab that happens to them. But y'all, please tell me what you think about this. I know this is something that's rampant out here, but it's not spoken about a lot, where your caretakers, doctors, nurses, nursing assistants are high sometimes more high than the patients, and have drug addiction issues. And many of them out here continue to work. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.